absorption ng lahat ng nutrients na intake natin, no, from food. Okay? So digestive system starts, no, from the oral cavity down to anus. So these are the objectives for our discussion for today. We will discuss the function of the digestive system. We will discuss or review the gross anatomy of the digestive system and discuss the histologic features of the alimentary tract. So digestive system consists of the tract from the mouth or oral cavity down to anus, no? As well as the digestive glands emptying into this tract. Primarily, the salivary glands, liver, and pancreas are accessory, no, uh, area, no, or organ of the digestive system. No? So we will discuss these accessory digestive glands on chapter 16. So functions of the digestive system to facilitate transport and digestion of food, promotes the absorptions of the product of digestion, and of course, elimination of undigested materials. These are the four major layers and organization of the digestive tract. Tandaan niyo po ito kasi from oral cavity down to anus, ito lang yung lagi nating pag-uusapan, no? Yung apat na layers na yan. So, can you give me one layer? Sa digestive tract. Yes, Eliza?
Mucosa.
Ano ba?
Mucosa.
Mucosa. Very good. Michelle.
Sabi
Sa mucosa. Dino.
Muscularis.
Muscularis. And Henry?
Serosa po.
Serosa or the adventitia. Okay. So very good. So that are the major layers, no, of the digestive tract. Okay. So remember that the stomach, small intestine, and large intestine are suspended by mesenteries that are the site of nerves, blood vessels, and lymphatics, no, from stomach down to the intestine. So ito na, isa-isahin na natin yung general structure ng four layers. So mucosa, ito yung innermost layer, no? Consists of epithelial lining. The lamina propria includes the blood vessels, lymphocytes, no? Lymphatics, smooth muscle cells, glands, and muscularis mucosae, also known as the mucous membrane. So this is the longitudinal section of esophagus showing the mucosa consisting of non-keratinized stratified squamous epithelium. Underneath is the lamina propria, and beneath we can see the muscularis mucosae with glands, no, emptying its secretion sa duct, no, mucosal gland. So asan ba yung mga yun? So can you see my cursor? So this is the lining epithelium ng esophagus, no, multiple, no, layers of flat, no, flat-like structures, no, so stratified kasi multiple layers, flat-like, squamous, no. We cannot see keratinization or keratin, no, sa area nito kasi moist naman yung esophagus. So this is the lining epithelium of the esophagus is stratified squamous non-keratinized epithelium. And beneath the epithelial layer, we can see the lamina propria, and underneath the lamina propria is the muscularis mucosae. So look at the ducts, no, emptied sila because dito naman napupunta So next, no, is the submucosa. So it is made up of dense lymphoid tissue. Anong function ng lymphoid tissue? Para saan ba yung lymphoid tissue? Yeah, ayun, left na siya. Anyone? So, hindi lang pala, no? Hindi lang pala yung sa tonsils, no? Hindi lang sa yes, Kim po.
It helps for immunity.
Ay na po.
For ano po? For immunity po?
Yan, for immunity, no? So, yung lymphoid tissue, ito yung ating mga kulani, di ba? So, meron din pala niyan, no, sa submucosa ng ating digestive tract, no? So, ito, sa submucosa, we can see the submucosal plexus of autonomic nerve or mace nerve plexus. Remember, di ba, there are two differentiation or ng meron tayong dalawang area or the the nervous system, di ba, is divided into two tracks. The central nervous system and the peripheral nervous system. I-review nga natin, pag central nervous system, ano included po? Okay. Yes, Castillo.
Ano po yung included right po, Doc?
Ako, anong mga structures included sa central nervous system?
Brain po.
Brain and
Brain and yung
brain.
spinal cord po.
Brain and? Sige. How about naman sa peripheral nervous system? Ano mga kasama sa peripheral, no? Ano natin? Nervous system. Henry? S. Eliza. Alonso.
Mga nerves po.
Mga nerves and ganglia. Peripheral nerves natin, no? So yun, di ba remember, no, meron tayong mga sympathetic, parasympathetic, yung mga autonomic nervous system. Pag yung autonomic nervous system is located, no, or ang location niya is nasa digestive tract, ang tawag na sa kanya ay, naalala niyo pa yun? Yes, iba naman, Alejandrino. Very good, no? So that's the enteric nervous system. So may sariling, no, innervation yung ating digestive tract. So sa submucosa ng digestive tract, meron siyang plexuses din or innervation, no, of the autonomic nervous system. Ang tawag sa kanya, Meissner's plexus. So ano bang ginagawa ng mga ito pag may autonomic sila? Alam naman natin, no, nagkakaroon ng peristalsis, di ba? Or movement, no? Or contraction doon sa ating intestinal tract, no, sa digestive tract, no, para ma-move yung ating food, no, from oral cavity down to anus. So, submucosa, which includes or meron sa kanya yung lymphatic vessels, venules, and arteriole for nutrients and blood supply. Muscularis, muscle, no? So, smooth muscle cells, meron tayong dalawang layer, inner circular layer and outer, no, longitudinal layer. Ito, meron din siyang autonomic myenteric na plexus known as the Auerbach plexus, no? Responsible din to for the contraction of muscularis, which mix, no, and propel the food, no, towards, no, doon sa ending, no, sa anus, no. So muscularis, may dalawang layer, the oblique and circular layer ng muscle with myenteric plexus or the Auerbach plexus. Meron din siyang longitudinal layer of muscle. Next is the serosa. Ito yung pinakamalayo, pinakalabas na outermost layer ng loose connective tissue naman sa kanya. Meron pa rin blood vessels, lymphatics, and adipose tissue. Lining epithelium ng serosa, tandaan nyo, is made up of mesothelium or simple squamous epithelium. No? In the abdominal cavity, serosa is continuous with the mesenteries. No? Etong mesenteries naman na to are continuous with the peritoneum. So let's start now with the oral cavity. So oral cavity is lined with stratified squamous epithelium, pwedeng keratinized depende sa location, pwedeng partially keratinized or non-keratinized. So bakit ganun, no? Pwede pala, no? Depende kung dry area ba siya, di ba? So pag dry area, di keratinized. Pagka moist area sa part ng oral cavity, mostly keratinized siya. So again, it is lined by stratified, no, squamous, non-cornified or non-keratinized epithelium, except no, yung hard palate, gingiva, and the filiform papillae of the tongue. So this slide, no, showing the boundaries, no. So natatandaan nyo pa itong mga area ng ating nasal cavity, no? So we have here the vestibule. You can see, no, the concha, the turbinates, no, and the nasal septum. Ano nga ulit ang function ng nasal septum? Ano ba ginagawa niya? Yes, Kimpo.
It moistens the air that comes inside the body po.
It moistens. Pwede. Check. Others answer? Still yun.
Separates the two nasal openings.
It separates, no, the nasal opening into right and left. Siya yung naghahati, no, nagdi-divide, no, into right and left. So that's the nasal septum, no. So also we can see in this slide, no, the oral cavity, yung sa bibig natin, no, with the tongue, no, pinakamalaking organ sa oral cavity, and the soft palate. So, submucosa, meron dyan ang lips natin, may submucosal area, cheeks, and soft palate. Remember that hard palate, no, wala sa kanyang submucosa. So, boundaries lang, oral vestibule at cleft-like interval between the gums and teeth internally, lips and cheeks externally. Oral cavity proper, large cavity behind the gums and teeth, continues with the pharynx, no? So, dito sa oral cavity natin, nangyayari yung chewing mechanism, no? Para ma-reduce natin yung food into smaller bits or smaller pieces. Ano ba yung mga organs na affected or involved, no? So, yung teeth or structure na involved. So, teeth, tongue, muscle of mastication, also chemical action from the enzyme, the salivary amylase, no? Na pinoproduce, no, ng ating mga saliva at ng ating mga salivary glands. Retromolar space naman, only communication between the oral vestibule and the oral cavity proper. Usually it is located, no, last two molars and the ramus of the mandible. So lips, yan. So merong mucosa siya. Consists of upper and lower. Dalawa naman ang lips talaga natin, up and down. It is, the skin of the lips is lined by stratified squamous, cornified, or keratinized epithelium. So this is slide showing, no, yung dalawang area ng lips natin. Merong non-keratinized, no, yung moist area, and then may keratinized stratified squamous epithelium. Ito yung mga dry area. Okay. So, this is the slide showing the lips and the oral mucosa. So, mayroon pala sa lips natin na dry area. Kaya nyo, no, pagka humid or mainit or nasa cold weather tayo or dry weather, ano nangyayari, or dehydrated, kulang sa tubig, ano nangyayari sa lips natin? Ano nangyayari sa lips nyo pag dry? Yan, nagbabalat po, nagka-crack, di ba? So, dapat hindi pala natin yung nilalagyan ng laway kasi nagcha-chop. Pagka nilalagyan ng laway, no, binabasa ng laway natin, di ba ganun ginagawa natin, nagiging, gusto maging mannerism. May mga microorganism kasi dun sa ating saliva na pag pinasok na or na-contact do sa open, sa dry chapped lips natin, it can cause also infection. So, dapat hindi pala ganun. So, you have to hydrate yourself and then maglagay tayo ng mga moisturizer. Pwede naman, marami nang nabibili ngayon, di ba? Yung mga lip balm, no? Medicated lip balm. Pero importante pa rin hydration. Submucosa contains labial glands with tubuloalveolar or small salivary glands. Mucosa is lined by stratified squamous non-cornified epithelium. So natatandaan niyo pa ba yung mga different layers of the skin, no? From stratum corneum sa outside down to stratum basale. So, bakit ba nagkakaroon ng chapping in cold and dry weather? Dahil yung area na to, yung vermilion border, no, it doesn't have hair follicle, sweat glands, and sebaceous gland. So, wala siyang mga ganun. Kaya mas prone, no, na magkaroon ng excessive dryness and chapping in cold and dry weather. So, ito yun, ang sabi yung vermilion na yan. So, this is a slide showing, no, the lip section, no, so under low magnification micrograph. Look at the oral mucosa, no, opposite side covered by skin containing follicle, and in between is the vermilion zone. So, tingnan natin nasaan ba siya. So, this is the oral mucosa, okay? And then this is the area na merong skin. In between sa dalawa, this is the vermilion zone. Napakanipis lang yan. So napakanipis dyan, translucent siya. Kaya even yung blood natin, no, nakikita. Kaya nagbibigay ng color red sa area. Kaya mapupula yung lips. Yan. So dito sa may skin na area, no, makikita natin meron siyang hair follicle. At yung lips natin are also made up of muscular or muscle, may mga muscles. Dito sa outer mucosa, meron tayong mga glands, no? Kaya moist yung area na yan. Dito sa area na to, nakikita niyo itong cursor ko? Nakikita yung cursor? Yes. So, itong area na to, so this is the vermilion, okay, zone in between the oral mucosa and the skin area. So, di mo may hair follicle pa rin banda dito. So, ito lang yung representation ng in between ng dalawa, ng oral mucosa and ng skin area ng lips natin is the vermilion. Very thin lang yan. So, cheeks stratified is made up of stratified, no, or lined by the stratified squamous keratinized epithelium. Superficial fascia with buccal fat and bucopharyngeal fascia. Tatandaan natin, no, yung vaccinator muscle, no? Submucosa made up of buccal glands, and mucosa is lined by simple squamous non-keratinized epithelium. Let's move on to tongue. Ito yung pinakasabi nila, no? Ito yung pinaka-strongest muscle ng body natin. Yung tongue, pag nagsalita yan, diba? Masyadong strong, okay? So, siya din yung pinaka-matigas, hindi, joke lang, na part or pinaka-strong na muscle ng body natin. Yeah? Pag minsan ginagamit natin siya, nakakasakit na tayo agad ng tao, no? Wala pa tayong ginagawa, nagsalita lang tayo. Okay? So, tongue is a mobile muscular organ. So, meron siyang sulcus terminalis and it contains many lingual papillae. So, the upper surface is rough, no? Sa tongue natin. The dorsum is divided by a V-shaped groove, no, known as the sulcus terminalis. No? Anterior two-third, meron siyang palatine portion, and posterior one-third pharyngeal portion. Ano ba yung tsura ng tongue na yan? So, ito na yung tongue natin, no, with lingual papillae and taste buds, no? Sa dorsal portion, the outermost portion, no, itong area na to, no, we can see the lingual tonsil, and this is the sulcus terminalis, no? And then the dorsal, yan, yung mga lingual papillae natin, no? So, this is the apex of the tongue. Sabi kanina sa slide, no, sa apex, no, dito natin nalalasahan yung sweet. Sa lateral area, the sour and salty, no? And then doon sa most posterior one, dito natin nalalasahan yung bitter. At sa gitna, no, yung umami taste. Okay, so we can see here, no, yung tongue with the different papilla. So we have the filiform papilla, fungiform papilla, and the foliate papilla. Okay, so yung filiform papillae, no, provide friction to help move food during chewing. Yung foliate naman, or a ridge-like structure located on the side of the tongue, are best developed in young children. Fungiform papillae naman are scattered across the dorsal surface, and yung ating valate papillae or circumvallate papillae are present, no, sa AV-shaped line near the terminal sulcus. So taste buds are present on fungiform and foliate papillae but are much more abundant on valate papillae. So look, oh, meron din siyang mga uh, cells, no, mga for taste, no, yung taste bud, sensory nerve, no, for that. Okay, next is the salivary glands. No, meron tayong parotid duct. We have your salivary gland. Kita natin, nandito siya, no? Near, no? Sa lobe ng ears. Okay? So this is the salivary, parotid salivary gland. We have the submandibular salivary gland and the sublingual located behind, no? Behind the tongue. So, pag ito nagkaroon ng infection, bacterial or viral infection, anong medical term for that? Or nag-inflammation? Sino yan? Yung parotid salivary gland. Anong medical term for that? Kitang-kita na yan, mga pasyente na yan, pagpunta nyo sa clinic, no? Meron silang kulay blue, okay? Sa kanilang leeg. Anong tawag doon? Moms, very good Castilian. So that's moms or parotitis. Okay? So, secondary to a viral infection. Dahil siya ay viral infection, ito ay self-limiting. Kusang mawawala, we give support na. Kung naglalagnat, we give paracetamol. Kung may pain, we can give pain reliever. No? Sa lalaki, pag ang parotitis nila o yung viral na nag-cause ng parotitis, no, nagpunta, no, sa scrotal area, no, nag-migrate, no, it can cause arthritis. No? Itong arthritis na to, nag-inflame na yung kanilang scrotal area, may possibility, probability na maging sterile sila, no? So nababaog. Pero maliit na porsyento. Pero may possibility pa rin. Yan, sabi nila, kaya ang moms, no, ay binibigay na bakuna sa mga bata. No? So meron tayong MMR moms, no, measles and rubella vaccine na libre lang. So, dapat nakakuha kayo niya nung baby pa lang kayo. To prevent moms. Okay, small salivary glands found on the undersurface of the tongue. So, ito yung lingual glands. Ito yung sublingual, di ba? Salivary glands. Also known as blandite and none, they produce mucoserous. No? Yung posterior lingual glands na makatawag sa kanila ay von Ebner's purely serous glands sila. So let's move on to teeth. Ilan ba ang teeth ng adult? So we have 32, no, permanent teeth. So pag binigyan natin dinivide natin yan sa into 4 quadrant, tige 8 yan. Okay, dalawang incisor, dalawang canine, premolar, and then molar. So permanent agad pag tumubo na yung molar or yung tagang. Okay? So, di pinaka, no, so, temporary, ang tawag sa kanila ay milk teeth or decidus teeth. So, 22 in number, 6 months to 6 years old, lumalabas yung 4 na incisor, dalawang canine o canine, no premolars, and 4 molars. Ang permanent teeth, lumalabas na yan, 6 years old hanggang 25 years old tayo. So, 32 sa adult, 4 incisor, 2 canine, 4 premolars, and 6 molar. Okay? And the hardest structure of the body is the enamel. No? 96% of it is made up of calcium hydroxyapatite. No? It is secreted by ameloblast. No? It is a columnar cells but do not persist in mature tooth. Saan ba galing to ameloblast? It is derived from ectodermal lining of the embryonic oral cavity. Next part of the teeth is the dentine, no, secreted by odontoblast. No? It is lined by the periphery of the pulp cavity persists in mature teeth. Okay. It is derived from mesoderm. Next is the cementum, no, secreted by cementocyte. Pareho lang siya o analogous siya with osteocyte ng bone. No? So it covers the dentine of the root. Okay? So periodontal ligament na ang ginagawa niya used to suspend the tooth in the bone socket. Usually ito yung shock absorber during mastication. And then we have the pulp cavity, no, present in crown and root. So pag nagpa-root canal tayo, ito yun. Ito yung inaano ng dentist. Sinisira para yung innervation. So wala na ng pandama yan. No? So kahit may infection siya, hindi na mo na mararamdaman. So the crown, the neck, and then the root. Okay, so periodontal ligament, ito yung nagsususpend, nagpapa-stay, no, doon sa tooth natin, doon sa uh, area niya. So meron tayo sa maxillary and sa mandible, sa bone. Next is the esophagus. So esophagus is a muscular tube, no, 25 centimeter long, which transports swallowed material from pharynx down to the stomach. Ano nga pala ang nangyari pagka hindi na tayo poor ang oral hygiene natin? So what will happen to your teeth? Diba? So itong gingiva na to, pwede siyang magkaroon ng infection due to poor hygiene, oral hygiene. So ano mangyayari dito sa area ng gingiva? Ito, pansinin natin pag ikaw ay pag nagtutoothbrush, mabilis magdugo, no, or nagtudugo siya kusa, so it is a sign of gingivitis. Bakit tayo nagkaka-inflammation ng gingiva? Most common pa rin is secondary to poor oral hygiene. So pag nagtutoothbrush, hindi nagpo-floss, so yan, mas mataas ang probability na magkaroon ng periodontal disease, and one of it is the gingivitis. Next is the esophagus, sabi nga natin, so may mucosa siya, thrown into longitudinal folds giving the lumen an irregular or stellate shape. Lining epithelium ng esophagus is stratified squamous, non-keratinized epithelium. So again, makikita pa rin natin yung 4 na layers, no? From mucosa, the innermost, followed by submucosa, muscularis, and then adventitia or the serosa. So pag tinignan natin to sa microscope, yun yung nature niya, di ba? Kasi hollow siya or tube-like structure. So yung mucosa ng esophagus is made up of loose connective tissue, the lamina propria. So may portional lymphatic tissue dyan, no? And it has esophageal cardiac glands. So your muscularis mucosa of the esophagus is formed by 2 layers of longitudinally arranged smooth muscles. So again, nakita natin ito yung lining epithelium ng esophagus, stratified squamous, non-keratinized epithelium, and then we can see here, no, the 4 layers, no. The innermost, no, is the mucosa, followed by the submucosa. We have here the muscle area, no, the muscularis externa, and then the outermost is the adventitia or the serosa. Again, look at here, no, the epithelium ng esophagus, no. But as it goes down, no, papupunta na siya sa stomach, ano nang nagiging lining epithelium niya, no? From stratified squamous at the esophago gastro junction, no, the junction between the esophagus and stomach, nagkakaroon tayo ng transition. Look at the lining epithelium over here. It becomes simple columnar epithelium, no? So pag tinignan nyo ito sa microscope, dapat tinitingnan nyo ang nagpo-focus kayo dito sa area nito kasi ito naman yung tinatanong. So these are the lining epithelium, no? So ito yung area nito, the junction between the esophagus and the stomach. Okay, so we can also see over here the blood vessels and the mucus gland together with the lamina propria located beneath the epithelium. And beneath the lamina propria, we can see the muscularis mucosa. Next is the submucosa, made up of dense collagenous tissue, contain the blood vessels, lymph vessels, and nerves. No? Ito may nerves plexus din. No? Deep esophageal glands and esophageal gland proper is located in the esophagus. So they are found in all segments of esophagus. So both the superficial and deep esophageal glands, ano ba ginagawa nito? It secretes mucus para saan? To lubricate mucosal surface to facilitate passage of food. So lubrication, no? Para madulas pagka dumaan na yung pagkain natin doon sa esophagus o kung ano yung nilunok natin, no? Papunta sa stomach. Anong tawag natin doon sa food na nasa o nasa mouth natin, oral cavity, habang nginunguya natin siya hanggang sa makarating siya sa esophagus? Anong tawag doon? Tapos pag, yes, Alejandrino. Very good, no? Bolus, no? Pag itong bolus na to, nakapunta na siya sa stomach, na exposed na sa acid, ano nang tawag sa kanya? Yes, Castillo.
Chyme po.
Very good, no? So, chyme naman na ang tawag sa kanya. So, i-breakdown pa siya ng mga acid sa stomach natin. So, this is slide showing, no, the histologic features of the esophagus, no? So, titingnan natin yung kanyang lining epithelium. Okay, so ito siya. Look at the glands, no, secreting mucus, no, for lubrication. Last is the muscularis externa, the muscle area, no? So they are arranged in layers with inner circular and outer longitudinal. Tandaan niyo po itong tatlong to ha. Ang upper third layer, no, muscularis external layer ng esophagus is made up of skeletal muscle. Yung middle one-third niya is mixture ng skeletal and smooth muscle. And as goes down, no, yung lower one-third, it become smooth muscle. So tandaan niyo po yan ha. Skeletal muscle sa upper one-third, lower one-third smooth muscle, middle one-third both smooth and skeletal muscle. So yung muscularis externa, no, is innervated by mesenteric plexus para sa contraction of smooth muscle. So representation of the esophagus with the innervation of Meissner or submucosal plexus and our back or enteric plexus, and also by the vagus nerve. So, yeah. Diba yung paano ba nag-move yung bolus natin, no? From pharynx down to esophagus, no? So, through peristaltic wave or movement, no? So, ayan. So, we can see here the musculature of the esophagus, no? With circular muscle layer, no? Ayan. And the trachea. Next is the tunica serosa or adventitia, made up of loose connective tissue. May mga blood vessels pa din, may mga plexuses pa din. Next, this hollow organ, the stomach. So, pagdating ng food natin, papunta sa esophagus, papunta na yan sa stomach. So, saang layer or quadra or region ng abdomen located ang stomach? Anong region ng abdomen? N1, nasaan ba yung stomach na yun? Nasa hypochondriac region, umbilical region, hypogastric region, iliac region ba siya? Saan? So the stomach is located at the epigastric region. Okay? So yan, sikmura. Diba? Kung masakit, alam nyo, stomach yung pag mahapdi yung sikmura ninyo. So yung Tagalog term, layman term for the stomach. Okay? So this is the stomach and its part, no? Fundit, fundus of the stomach, the body or corpus of the stomach, and the pyloric part, no, of the stomach. So remember the lesser curvature and the greater curvature within the mesenteries, no, are attached, no. So here we can see the liver, no, is lifted, no, and the gallbladder. Okay? So, we have sphincter, no? Dito sa esophagus and sa stomach. So, dapat yung sphincter na yun ay patent or competent because if not, yung inferior esophageal sphincter, if it is incompetent, what will happen? Hindi niya close open tong area na to. So, what will happen? Yung food natin from esophagus, pag napunta siya sa stomach, no, because of the incompetent lower esophageal sphincter or the inferior esophageal sphincter, so what will happen? Yung food natin from the stomach will go back, can regurgitate, no, to the esophageal area. No? Pag hindi natin siya minanage, no, or tinreat, what will happen, no? So the acid coming from the stomach will go to the esophagus, destroying, no, altering the stratified squamous epithelium of the esophagus. So ano mangyayari? It can cause cancer known as the Barrett esophagus. So common ito sa mga patient na may prolonged standing gastroesophageal reflux disease. I think naririnig niyo ba yung GERD? Care? Yan, sabi niya, yes. Or yung iba naman, nagkakaroon sila ng gastroesophageal disease, no? Like secondary to H. pylori infection. So para ma-diagnose siya talaga na may H. pylori infection, so we do endoscopy. So may probe na pinapasok sa bibig, papunta sa stomach, and then may test na ginagawa kung magpa-positive sa H. pylori. Nagkakaroon din tayo ng mga ulcerations dyan sa stomach natin. Secondary yan sa mga, una, it's diet, no? Pangalawa, bakit nagkaka-ulcers ang patient natin lalo sa matatanda? If they are left and right na umiinom ng mga non-steroidal anti-inflammatory disease, the arthritis, no? Yung naproxen, napakalakas niya magka-bleed, no, ng stomach. Okay? So, yung ulcers, no? Kasi minsan masakit ang sikmura, may ulcer po ako. Pero hindi naman nag-undergo ng endoscopy. So, ang diagnostic, no, definite diagnostic for ulcer, no, para makita ko may ulceration sa stomach is through endoscopy. Okay? So, kung merong lower esophageal sphincter, no, na humaharang sa esophagus and sa stomach, meron din tayong sphincter, no, the pyloric sphincter naman. Dito sa may lower part ng stomach, no, papunta sa duodenum. Okay? So, dapat yung food na galing sa stomach, bababa siya sa duodenum, first part na duodenum, hindi siya dapat bumabalik. Okay? So, yeah. So, most expanded portion of the GI tract is the stomach. May quadrilateral interlongitudinal folds known as the rugae, numerous with gastric pits. So, ito yung ating stomach. We have the cardiac zone over here, the opening, no? Yung ating esophageal, no, junction. The rugae, ito yung mga pits natin, rugae. Kaya itsura ng stomach. So, acid ang ating pH dito. So, we have the pyloric sphincter, no? Simple columnar epithelium without goblet cells. Ang lining ng stomach. So, the lamina propria is made of loose connective tissue and also contains lymphatic tissues and nodules, no? Which occupies, no, the gastric glands occupy the entire thickness of the lamina propria. So, they are usually mucus-secreting cells. So, ito ulit, yung representation ng ating junction, no, the esophago-gastro junction. No, esophagus to, kitang-kita natin yung lining niya, no? Stratified squamous epithelium, non-keratinized. Paglating niya rito sa area ng stomach, the epithelial became simple columnar epithelium. Nakikita natin yung invagination over here, so that's the gastric pits, no? So we have here the esophageal, the cardiac glands, no, ng ating stomach. So smooth muscle over here. Muscularis mucosa, form of two layers of smooth muscles, inner circular and outer longitudinal. Sa mucosa, meron pa ng blood vessel, lymphatics, and syempre plexus, no, the base nerve plexus. So walang glands no, located at the submucosa ng stomach. So ito pa rin yung ating layers sa stomach, no, the mucosa, submucosa, the muscularis externa, and the serosa. So we can see also blood vessel no, dito sa ating submucosal area. Stomach, muscularis externa consists of 3 layers, inner oblique, middle circular, and outer longitudinal layer. Esophagus, no, remember your cardiac, kaya bakit ganun nasa stomach cardio, no, ECG, no? Because itong area na to ang tawag sa kanya is cardiac area kasi malapit na dyan yung heart. Stomach, tunica serosa, the outermost layer, basilar peritoneal layer made up of loose connective tissue lined by mesothelium or the simple squamous epithelium. So ito ang stomach natin, no? Cross section. So look at your simple columnar epithelium. Ayan, kitang-kita with goblet cells. Ano ba yung mga cells found in the gastric? Sa mucous neck, makikita natin yung mga mucus-secreting columnar cell. They are pale staining. Chief cell, principal cell or cymogenic cells, no, low columnar cuboidal basophilic cells. It secretes pepsinogen. So ito yung mga chief cells, yung area na yan. At look at this, ito yung pepsinogen. So remember the chief cells, it secretes pepsinogen and gastric lipase. Parietal cells secretes intrinsic factor and HCl, while the mucous neck cells, no, and you can see the muscularis mucosae. Ito yung muscularis mucosae, ito yung mucous neck cell. Parietal cells or oxyntic cells, no, characteristic cells of the stomach. It secretes by HCl and intrinsic factor. Remember, intrinsic factor is important sa vitamin B12, no, absorption natin. So those patient na may problema, no, sa parietal cells, no, nagkakaroon sila ng problem with the absorption of B12, no, vitamin B12. It can lead to a type of anemia. Yung anong klaseng anemia yung with B12 problem? Iron deficiency anemia ba siya? Blood loss anemia ba siya? Anyone? Tatandaan niyo ba yun? The discussion sa blood ng ano eh, ng anatomy. Yes. Uligit.
Pernicious anemia po.
Yo, so that's the pernicious anemia. So importante rin, no, yung ating parietal cells, no, sa blood natin. Okay, so meron siya doon because of the intrinsic factor na sinisecrete niya. So this is how the parietal cells look like under the microscope. So basophilic stain sila. Your argentaphene cells or enterochromatin cells, no? So they are the one responsible for secreting serotonin and histamine. So found in the walls of stomach and stomach wall of the small and large intestine. So remember, ito meron din sa book nito, no? So ano ba yung mga substance secreted and ano ba tong cell types natin? So sa stomach, meron tayong mucous neck cell, parietal cells, enterochromatin like cell, the chief cells, B cells, and G cells. And the substances secreted are stated here, no? Chief cell, pepsinogen and gastric lipase. B cell, somatostatin, which inhibit acid. G cell, gastrin, which stimulates acid, no? Your enterochromatin-like cells and your G cells both stimulate acid production, no? Your parietal cells secretes intrinsic factor and is responsible for calcium absorption. Gastric acid or HCl is secreted also by parietal cell, while the mucous cells secretes bicarbonate, no, pang-buffer yan, no? And your mucus protecting lining. So, three types of gastric cells: fundic glands. They are simple branch tubular glands, slightly coiled. Gastric peaks are occupying one-fourth thick of the mucosa. Lumen is narrow. Ito yan. Itsura ng fundic glands. Pyloric glands, tubular glands, no? Lumen is wider. Siya yan. But these are your pyloric glands. Cardial glands, simple tubular glands. Gastric pits are short and shallow. Again, the different layers, no, of the stomach. Mucosa, submucosa, muscularis, and the serosa, where the connective tissue layers are located. So, muscularis niya, we have the oblique, circular, and longitudinal muscle layer. Glands and the muscularis mucosae. Now, let's move on to small intestines. Kaya pa? Di na. Break? Sige ba mag-break? O, diretso na natin. So, portion between stomach and the large intestine. Saan natin nakikita sa abdomen ang small intestine and large intestine? Anong quadrant, no? So, dahil mahaba ito, so almost all of the quadrants, no, we can look for the small intestine, no? Anchored to the posterior body wall by means of mesentery. Digestion is completed in this part. So, dahil natapos na, no, ng stomach yung digestion, ang gagawin na lang ng katawan natin ng small intestine is absorption ng nutrients. Okay? So, average length, no, approximately 5 meters, may tatlong segment siya. Duodenum, jejunum, and ileum. So, first 25 centimeter, no, is the duodenum. At yung naka-attach na ating continuation niya siya ng stomach. And then jejunum followed by ileum, na pinaka-malayong area. So, small intestine. And then the layers of the and regions of the small intestine. So, duodenum, jejunum, and then ileum. Ileum will continue with the large intestine. So, modification in the mucosa and submucosa of the small intestine. Meron, ano naman ang kakaiba dito sa ating small intestine? Andaan nyo, pag small intestine, meron dyan dahil sa absorption ang kanyang function, andyan lahat ang microvilli. Remember, ang organelle na microvilli, it will, anong ginagawa niya nga ulit? What is the function of microvilli? Yes, Cruz.
Ano po, it helps from the movement po and protection, Doc.
Okay. Ang gagawin niya, protection, yes. At ang microvilli po ay nag-i-increase, remember, ng surface area. Kaya nga, mas ang absorption ng nutrients ay nagaganap, no, sa small intestine. Okay? So, this is the small intestine. Again, it is lined by simple columnar epithelium with goblet cells. So, horizontal mucosal folds, no, dito sa small intestine nyo lang makikita yung mga mucosal folds na yan, known as the plica circularis or valves or trim. The luminal surface of the small intestine is wrinkled when examined in the naked eye. Consists of mucosa and submucosa. So, ano ba yung mga plica circularis? Ayan lang siya. Okay, mga folds, no, sa small intestine. Yung folds doon sa stomach, ang tawag ay okay. Pagdating sa small intestine, ito mga folds na ito, ang tawag na ay plica circularis, no? So, look, meron din siyang submucosa, no, muscular layer made of circular longitudinal layer, And then, of course, you have the serosa. And itong pinaka-distinct feature niya, no? Nasa kanya yung mga microvilli. Microvilli are finger-like projection. Most develop ang horizontal mucosal folds or plica circulare sa jejunum. Absent ito sa duodenum and distal half of ileum. Okay, these are your plica circulare or bulb or curlings, no? Circular folds of ring, no? Intestinal villi, no? So, finger-like projection that projects into the lumen, no? And it consists of core lamina propria and the epithelium possesses variable number of microvilli known as the brush border, no? Meron din dito mga columnar cells known as the enterocyte. Ano ba ginagawa ng brush border, no? They are densely packed microvilli, no? Covered by glycocalyx. So maraming microvilli sa proximal segment of the small intestine as compared to ileum, which is the distal segment of the small intestine. Okay? So variation in shape ng mga villi na yan depende sa itsura. Broad and fang-like, nakikita yan sa duodenum. Narrow and finger-like sa jejunum. And club shape in ileum. So remember, no, as the intestine from proximal to distal, no, yung ileum, from duodenum to ileum, no, as papunta yung ating area sa ileum, nawawala na yung mga microvilli. So ayan na, several folds located at the jejunum. Look at the plica, which are distinct, no, itong mga to, mga plica circularis or projecting folds. Okay, so look at the villi. Ito yung mga projecting folds, villi for absorption, the submucosal area, the mucosa, and the serosa. Look at the muscularis ng mga muscles. So, plica circularis, ito lang naman yun. And then you have your velus, no? We have the inner circular smooth muscle, the outer longitudinal, and of course the submucosa just beneath, no, the mucosa. Crypts of Lieberkühn, the invagination of lining epithelium forming short tuberal glands found between the bases of the intestinal villi. You have your Paneth cells, so for immunity, the crypt of Lieberkühn, kita yan sa duodenum, ileum. May 4 na types, no? Yung enterocyte, sabi natin, so absorptive cell. Responsible for absorbing nutrients from the lumen. So also responsible for transport, no, of these absorbed nutrients across the epithelium to lamina propria where they diffuse the blood lymphatic capillaries. O alam natin lahat, ano ba ginagawa ng goblet cells? Function ng goblet cells. Yes, Castillo.
Secretes mucus po.
Mucus. Okay. So, the goblet cells present in the entire surface of the epithelium of the intestine. It secretes mucus, it gives protection, no, doon sa ating small intestine. The nucleus of the goblet cells are flattened, strongly basophilic ang kailang cytoplasm, and it secretes mucus, serve for lubrication and also to protect the surface of the epithelium. Increase in numbers that goes down to the segment of intestine. Yung villi kanina as it goes down, no, from duodenum to ileum, kumukonti. Pero itong microvilli, ito namang goblet cells natin, no, as it goes down sa segment ng small intestine, no, mas dumadami siya. So, ileum with Paneth cells again. Ano ba itong Paneth cells? Found in the basal portion of the intestinal crypts. They are pyramidal in shape. Their nucleus are round or oval with acidophilic secretory granules at the apical cytoplasm. Paneth cells, so for immunity. Enteroendocrine cells, they are small cells. Secretes ng peptide, no, or hormones. Control peristalsis, so yung paggalaw ng bituka. Regulation and secretion for food digestion, and satiety. Endocrine cells, may mga, ito naka-table na to ha, sa, sa inyong book, no? So tingnan na lang yung table sa book, doon yung saan siya located, naka-column na siya, naka-table siya, ano yung kanyang ginagawa, no? Ito ba inhibitory or nagpo-promote? So nandiyan lahat siya, no? So D1 cells, duodenal mucosa siya nakikita, source of enteric glucagon. G cells, gastric antrum, secretes gastrin. L cells, intestinal mucosa, secretes glucagon-like substance. S cells, intestinal mucosa din, secretes secretin. And I cells, duodenal mucosa, its source of cholecystokinin. So cholecystokinin po, ginagamit ito sa ating lipid or triglyceride digestion. So layers of the walls of the small intestine, same pa din, mucosa, submucosa, di ba? So yung mucosa is made up of simple columnar with goblet cells. Lamina propria, loose connective tissue. Dalawa lang sa muscularis mucosa niya. Submucosa, dense connective tissue, you have your inner circular and outer longitudinal layer for the muscularis area. And kung sa submucosa is made up of dense connective tissue, sa tunica adventitia or serosa, it is made up of loose connective tissue. So ito lang ating small intestine and its layers. Next is the duodenum. Ito pala yung first part natin, no? Shortest, widest, the most fixed part. So it is a retroperitoneal. Pag retroperitoneal, it is located behind the peritoneum. No? So they are closely attached to the dorsal wall of the abdomen. Usually the duodenum is 10 inch long and the mesentery is absent. Sa first part ng duodenum, doon nakasit ang head ng pancreas. No? So they have plica, the plica circularis, no, is absent in the first part of the duodenum. Intestinal villi are numerous and usually they are leaf-like. Mucosa niya, simple columnar with goblet cells. Lamina propria, loose connective tissue with lymphatic tissue, and the muscularis mucosa is made up of smooth muscle. Submucosa, dense connective tissue, it contains Brunner's gland. So, pag duodenum, Brunner's gland, tatandaan niya na the Brunner's gland are branch called tubular gland. It secretes viscous alkaline fluid. Bakit nagsisecrete siya ng alkaline fluid? Remember, no? Yung ating chyme, pag nasa stomach siya, nakakontakt na siya yung chyme o yung bolus pag nagpunta na sa stomach, magiging chyme, so may contact na sa acid. So, acidic ang environment noong stomach natin. Ang environment naman pagdating sa duodenum is more on alkaline. Okay? So, alkaline siya to neutralize yung chyme na bababa from the stomach papunta na duodenum para hindi masira, no, yung ating duodenum. Kaya ang pH niyan is more on alkaline as compared to your stomach. Okay, so function is to protect the duodenal mucosa against the erosive effect of the acid. Kaya more on alkaline yung pH ng ating submucosa sa duodenum. So, okay. Slide of the duodenum. Look at the simple columnar epithelium. Look at the muscularis mucosa and the glands, duodenal glands. Tunica muscularis, inner circular, outer longitudinal with our back plexus. Again, this plexus is responsible no innervation for the peristalsis or contraction. And then you have your serosa, which is lined by mesothelium. Jejunum and ileum, the division is not clear, but they are both lined by simple columnar epithelium with goblet cells. So marami din silang lymphatic nodule, no? So lymphatic nodule is more pronounced in ileum. Tawag naman dyan sa ileum yung mga lymphatic nodules, tandaan nyo, is Peyer's patches. Peyer's patches, nakikita lang yan sa ileum. So there is no glands in the submucosa. Plica circularis, mas develop sa jejunum, wala sa ileum. Intestinal villi, meron sa jejunum, meron din sa ileum. Sa finger-like lang ang itsura ng sa jejunum, club shape naman for ileum. Length ng jejunum, 8 feet, pero mas mahaba ang ileum, 12 feet. No? So walang mesentery is present and they are both movable. Unlike ng duodenum which is a retroperitoneal organ. So tapos na tayo sa intestine, let's move sa last part which is the large intestine. From ileocecal junction to the anal opening, 5 to 6 feet long. Subdivided, ito yan, cecum, appendix, colon, rectum, and anal canal. Ano ba yung mga walls, layers, same mucosa na pagdating sa colon, no? Sa colon, ito na yung storage no ng mga undigested fecal material. So lahat ng tae nandun nasa colon, okay? So the mucosa of the large intestine is made up of simple columnar pa din with goblet cells. So from stomach down to large intestine, what is the lining epithelium? Anyone? Andiyan pa ba kayo? Wala na akong kausap. Andiyan pa po kayo? Wala na. Sa sino makakasagot nito? May plus. From stomach down to large intestine. Ano ang lining epithelium? O, diba may plus? Ang bibilis. Alonso.
Simple columnar epithelium with goblet cells po.
Excellent. No? Hindi na kayo malilito. Yun na ang iisipin nyo. No? Simple columnar. Diba? Epithelium with goblet cells. So kahit paikot-ikutin namin kayo dyan, kahit small intestine yan, kahit large intestine yan, jejunum, pag tinanong namin what is the lining epithelium, diba? Kahit nakapikit, masasagot nyo, simple columnar epithelium with goblet cells. Okay? So, dito sa layers ng large intestine, meron tayo, less na yung lymphatic tissue. It contains naman intestinal glands. Muscularis mucosa niya made up of smooth muscle, submucosa made up of dense collagenous tissue. Tunica muscularis, inner circular, laging ganun, and outer longitudinal. Next is the appendix, the rectum, and anal canal. Cecum, colon, so ang kanila naman complete inner circular and outer longitudinal. Meron sa colon natin, no, yung tinatawag na band, no, flat bands known as the taenia coli. At paano natin ma-distinguish ang large intestine from small intestine? Sa large intestine, meron yung sacculation or haustra, no? Tunica serosa nila is covered by peritoneum, such as yung cecum, appendix, transverse colon, and sigmoid. Covered dyan ng peritoneum. Okay? The rest are partially covered by peritoneum. Anal canal has no peritoneal covering. Appendices epiplocae, pouches with adipose tissue found in the colon. Mamaya di-discuss natin yan. Ayan, ito mas maganda to. So, ito na yung colon natin. Okay. So, diba, distal part ng small intestine is the ileum. So, may connection sa colon, sa cecum, with the ileocecal opening. Okay. So, dito makikita natin itong finger-like projection. So, this is the appendix. Saan located sa abdomen? What quadrant ang appendix? Nakikita ang appendix, JV. Yes, so nga.
Sa lower right quadrant po ba?
Excellent. So, Isaiah no, sa right lower quadrant. Meron na ba sa inyong naoperahan ng appendix? Tanggalan ng appendix? Taas kamay. So, wala pa, no? So, ang naman nangyayari, no? nagkakaroon ng inflammation ng appendix known as the appendicitis, no? Yung appendicitis natin, bakit nagkaka-inflammation ang appendix? According to studies na sa literature, no, most common reason is due to fecal leak or yung dumi na napunta doon sa appendix. Di ba may peristalsis kasi dyan, may movement dyan. So pag yung dumi na yun, maliit na dumi na punta doon sa lumen ng appendix, it can cause obstruction. Pag nagka-obstruction yung secretion ng appendix, may stay doon hanggang mag-cause ito ng inflammation. That's why nagkakaroon ng inflammation ng appendix. Okay? So ano nararamdaman ng pasyente? Usually, ang manifestation niyan is magkakaroon ng nausea si patient, no, ayaw lang ganang kumain, nagsusuka, masakit ang tiyan. Yung sakit ng tiyan niya, very vague, mag-start sa epigastric area, and then magmamigrate no, sa umbilical area hanggang sa mapunta na siya sa right lower quadrant. Okay? So, pag nagpunta si patient sa atin, right lower quadrant pain, isa sa iisipin natin agad is appendicitis. Pag babae, dahil nandiyan din yung ovaries ang part of the uterus, no, and fallopian tube, pwede nating isipin na mga pwedeng secondary sa reproductive, no, area. So, automatic yan. Lalo na pag delayed care, pag nagpa-check up, tas may sexual contact, no, pregnancy test. Okay? So, para ma-rule out baka pregnancy pala, ectopic pregnancy, kasi nasa right lower din naman yung female organ natin, no? So, pag clear na hindi talaga siya, no, buntis, so susunod is most probably appendicitis na siya. So, right lower quadrant pain. Paano yung pain? Pag pinalpate, pag piniga or pinindot yung right lower quadrant, masakit. Pag binitawan, mas masakit, no? Or kaya pinalpate, no? Ang tawag doon is rebound, no? Or direct tenderness. Pag naman pinalpate sa left lower quadrant, or diniin yung left lower quadrant, tapos ni-release, ang sasakit punta dun sa right lower quadrant. So that's a rebound tenderness, no? So may mga test na ginagawa. So kailangan ng CBC, makikita elevated yung WBC kasi may infection. Sa urinalysis, kasi urinary tract infection lang din naman pala. So pag sa urinalysis ng patient with suspect na appendicitis, usually normal, walang bacteria, walang WBC count, walang RBC count. So pag normal ang CBC, ay ang urinalysis, mataas ang WBC sa CBC with predominantly segmenters, no, or neutrophils, no, mas mataas yung probability, no, na appendicitis yung sakit ng patient. Doktora, pwede po bang gamot na lang, uuwi po kami? Wala pong ganun. So, pagka nag-inflame na yung appendix na yan, pwede kasing sasabog siya and then kakalat niya, no? Yun, infection sa buong katawan causing sepsis. So, pagka ganun po, tinatanggal po talaga yung appendix, no? So, the patient will undergo appendectomy or removal of the appendix, no? So, hindi siya elective, so emergency ang ginagawang operation for that. Okay? So ito nga sabi natin kanina, very, very distinct, no, for the large intestine, no. Makikita natin itong mga itong ganitong itsura, no. Yan. So, kung area na to, so this is the band, no, itong mga to. Hindi yung fat sa itong mga to. So, band na yan. Anong tawag dyan? So, this is the Taenia coli. So, look, no, meron siyang ganito, ganyan. So, that's haustration or sacculation. So, ito specific lang yun sa large intestine. So, cecum, aakyat siya. That's the ascending, okay, colon. And then, transverse colon, bababa. So, descending colon. And then, magiging bababa pa siya and it will become sigmoid. Sa left na to ha. And then rectum and then anus. So ganun ang ating orientation ng colon or the large intestine. So sa kanya lang may tinea, sa kanya lang may haustration, okay? Sa kanya lang din yung may appendix, no? So, cross-section between large and small intestine. So, villi, nakikita natin sa small intestine. No? Crypts naman, pareho silang meron. Goblet cells, more on sa colon or sa large intestine. Sa mucosa, pareho silang may muscularis mucosa. Andun din yung mga blood vessel. And then they have both serosa and muscular layer. Appendix, vermiform appendix, no, projecting from the cecum to the ileocecal valve. Layers made up of simple columnar pa rin with goblet cell. It contains diffuse lymphatic tissue. So ito palang appendix natin is a lymphatic tissue. So nung bata tayo, yung function niya is to protect us against infection. It secretes IgA or the immunoglobulin A. So protektado pa din yung ating intestine. However, as we grow old, no, nawawala na yung function niya na nagpo-produce, no, ng immunoglobulin A. Yun nga lang, pag minanas at na-infect siya, pwede pa itong maging reason para ma-operahan tayo. Pero yung sasabing kakain, huwag kang pakakain mo pa lang, huwag kang takbo ng takbo, huwag kang tatalon. Magkaka-appendix ka. Appendicitis ka. True or false? Wala na ako itong kausap. True or false? Pagka daw kakakain lang natin, bawal tayong tumalon, bawal tayong tumakbo. Kasi magkaka-appendicitis tayo. False. Very good, Castillo. So, hindi totoo yun, no? So, nagkakaroon lang tayo ng appendicitis pag natatrap doon due to peristalsis kasi, no? Yes, and ng fecal leaf. Pangalawa, true or false, pag kumakain tayo ng buto, lumulunok tayo ng buto, magkaka-appendicitis tayo. Buto ng sampalok, buto ng sili, buto ng kamatis. False. So, second, no, reason bakit nagkakaroon ng inflammation ng appendix natin is secondary to SIDS, no? So, pwede mag-cause ng appendicitis pag na-trap yung buto na hindi kasi natin nadadigest, no? Pag na-trap yung buto doon sa area na yon, it can cause appendicitis. True or false? Marami kang bulate, pwede kang magka-appendicitis. Ascaris. True or false? Yes, true. Pwede kasi dahil ang bulate, no, one way lang yan. Pag gumalaw, kung forward, puro forward. Wala siyang atras puro forward lang siya. So kung naligaw siya, no, nakapunta siya doon sa appendix, no, it can cause obstruction, no, and it can cause inflammation also in appendicitis. Okay? Yeah. So this is the histologic features of the appendix, no, with the simple columnar epithelium with goblet cells. Sa mucosa, it contains lymphatic nodules, blood vessels, and nerves. Kaya nga, masakit pag inflame siya, no? Meron siyang innervation. Tunica muscularis, inner circular and outer longitudinal pa rin. Serosa, it is covered with peritoneum, 9-big mesothelium. Yan, ganyan lang kaliit ang appendix, no? Itong area na to. Duruin mo, wala na siyang alas ka, nagkaroon pa siya ng fecal leaf, nagkaroon siya ng ascaris, nagkaroon siya ng buto na hindi na digest, it can cause inflammation. Okay? Look at your haustration, napaganda, or sacculation. So alam mo na ito ay large intestine. Okay. and the Taenia coli, the band, no? Over here. Yeah, same pa din, no? In ileocecal valve, no? Look at the circulation and the appendix. Now, next is the rectum. Extended from sigmoid to pelvic diaphragm, occurs in front of the third sacral vertebra, 12 centimeters long, slightly dilated in its lower portion, and meron siyang rectal ampulla. Mucosa, siyempre naman, line pa rin, may simple columnar epithelium with goblet cells. Goblet cells are most numerous in the rectum. Mas marami dyan sa rectum. Lamina propria contains transverse mucosa known as the plicae transversalis recti. Submucosa, same, dense collagenous tissue, blood vessels, and nerve. Outer and inner circular submuscularis externa. Found in the posterior wall ang serosa. So, ito po yung ating rectum. No? So, rectum, makikita niyo yung cursor ko, di po ba? Kayo hindi ko nakikita kasi nakikita niyo yung cursor? Yeah, thank you. So, ito yung cursor. Itong line na to, this is called pectinate or dentate line. So, narinig niyo na ba? Aware ba kayo sa word na hemorrhoids? Yes, no? Anong Tagalog ng hemorrhoids? Ano kaya ang Tagalog ng hemorrhoids? Ayan, sabi ni Andrew, no? Almoranas, correct. There are two types of hemorrhoids, internal and external hemorrhoids. Paano natin siya ma-differentiate kung internal or external hemorrhoid siya? No, yung internal hemorrhoids, makikita natin na they are located above, no, the pectinate or dentate line. No? So, yan. Dito sa area na to. So, bumababa lang siya pag masyado na siya malaki, lalo na pag thrombus na siya, no? Yung nangingitim na. So, pag ganun, ino-operahan yun. May grading tayo sa hemorrhoids, grade 1, 2, 3, 4. Pag grade 4, ibig sabihin, hindi na siya pwede bumalik. Ito na yung ino-operahan na indication para operahan yung pasyente natin. Pag naman ang hemorrhoids, no, ay below the pectinate or dentate lane, ang tawag dyan ay external hemorrhoids. Tingnan natin, no, meron din pala talaga, no, mga hairs, no, sa perianal skin, no, sa puwet nyo, may mga hair din yan. Tawag yata dyan bornic, no. So, meron tayong sweat glands dito sa area na to. Then, meron tayong internal sphincter, no, muscle, no. So, yung sphincter na to, ito yung naman yung responsible para mapigilan natin yung pagdumi natin. Okay? Those individual na naoperahan na ng hemorrhoids o nag-undergo na ng hemorrhoidectomy, nada-damage din yung internal sphincter nila. No? So, nawawalan sila, pero hindi lahat. No? Nada-damage, tapos nawawalan sila ng pag-control sa pagdumi. So, yun lang yung disadvantage, no? Pag napa-opera ng hemorrhoids. Pero kung talagang malaki na thrombus na nangingitim na mamamatay, kasi part siya ng intestine natin. So, it can cause infection and pwedeng makaroon ng effect doon sa other part ng large intestine. So, talagang pinapa-operahan niya. Tsaka hindi na siya makaka-defecate kung masyadong maga, no, yung area na yun. So, yung internal sphincter muscle, no, pwedeng ma-damage. Kaya yung mga undergo ng hemorrhoidectomy, wala na sila ng pang-control ng pagdumi nila. So, pag nakaramdam sila, dapat may available na CR kasi ililet go nila talaga yung masamang hangin na yan. Or yung dumi. Anal canal, terminal portion of the large intestine, 1.5 inch long. May 2 portion lang siya. Upper half, lined by simple columnar. Pero hanggang anal canal, simple columnar with goblet cells yung upper half. Longitudinal folds, meron dito known as the Morgado. Inner circular muscle thickens to form the internal anal sphincter. Lower half, eto na. So lower half na tayo, nagbago na yung kanyang lining epithelium. It is now lined by stratified epithelium. So, sa lower half ng anus, meron tayong semilunar folds known as anal valve or Morgado. So, the lamina propria, no, contains lymphatic tissue. So muscularis mucosa disappears in the lower half of the anal canal. The submucosa contains the hemorrhoidal plexuses or plexus of veins. So yan, mga ugat-ugat. Okay. External anal sphincters are conferential annulus substrated or voluntary muscle. So ito yung anal canal. No? May mga muscles siya. Meron siyang sphincter. So paano ba natin tinitest, no? Kung merong hemorrhoids or wala? Usually pupunta yan sa iyo. Pag dudumi po ako, may dugo. Yan, isa yan sa pwedeng na may fissure, no? Or nag-crack, no? Dahil, bakit nagkaganon? One, pwedeng constipation dahil sa diet. No? Hindi kumakain ng high fiber diet, puro meat. So they are prone to have constipation, di uminom ng tubig. Pangalawa, matagal sa CR, no? Nanonood, kung ano ginagawa. So, nakaupo siya doon. Yung pressure ng abdomen na napupush yung rectal area. Lalo sa anal area. Kaya nagkakaroon sila ng hemorrhoids. 3, pag yung mga babae nanganganak, no, they are prone to have hemorrhoids. So, yung dahil sa pressure ng pag-ire during the vaginal delivery. So, pag ganun, we do digital rectal exam. So, papakilala sa i-introduce natin yung sarili natin. And then, kung ni-refer siya, syempre, i-verify natin. So, doctors ang gumagawa na each gender, no patient ko siya ba talaga. And then, we do digital rectal examination. Digit kasi kaya digital. So, we insert our digit. So, naka-double gloves ka dyan. Maglalagay tayo ng lubricating, no? Na lubricant dun sa, para hindi masakit. And then, ipoposition yung pasyente ng jackknife position or pwedeng fetal position para ma-open or ma-relax yung anal canal. No? So we put the finger and then we palpate, no? Clockwise, no? From 12 o'clock position, 3 o'clock, 6 o'clock, and then 9 o'clock position. Titingnan kung may mass, may bukol, no? Titingnan dito kung lalaki, look at the bladder, and kung lalaki yan, nandito yung prostate gland niya. So, makakapa mo din kung may irregularity or enlarge yung prostate gland. So, titingnan mo yan. And then, kung may hemorrhoids, makakapa o pwede pa ibalik o hindi na. Okay? And then, tatanggalin yung tactating finger, no? And then, check yung finger kung may blood, no? Or kung mayroong intact, sasabihin din, no? Sa test, examination result, kung intact ba yung sphincteric bone, kung marami ba dumi sa loob, empty ba yung rectal vault, or full yung rectal vault. So yung figure natin na ginamit dito, ipupuna sa slide, no? So check kung meron pang ibang findings sa pasyente natin. So yung mga patient na may colon cancer, sabi nga natin, di ba, sa colon, doon na yung storage. Malaki masyado yung colon. Kaya kung magkaroon ng bukol sa colon, hindi agad nang ma-manifest, hindi agad nararamdaman ng pasyente. Kaya usually yung mga patient with colon cancer, no, late na pag na-diagnose sila, usually nag-metastasize na or kumalat na sa ibang lugar, no, lumipat na sa ibang lugar. Kasi nga, walang manifestation eh. And pag malaki na yung bukol, nag-obstruct na siya, pag dudumi, magkakaroon ng change ng dumi, itsura ng dumi. So, nagiging parang tain ng kambing. So, ganun kaliliit, no? Yung dumi ng pasyente natin with colon cancer associated with, minsan may dugo, yung dumi nila, tapos nag-weight loss. So, yung mga may family history ng colon cancer, dapat nag-undergo sila once a year ng ng test, no? Kung sa taas ng bibig dumaan papunta sa stomach, ang tawag endoscopy. Pag naman dumaan yung scope naman sa puwetan, no, papunta sa colon, ang tawag doon is colonoscopy. So we do sigmoidoscopy, sigmoid proctoscopy, or colonoscopy para ma-diagnose agad kung may cancer cell ba or wala yung patient. No? Kasi late na nga yung manifestation para magkaroon ng hint yung pasyente na may colon cancer na pala siya. No? So, ano pa mga pwedeng maging sakit natin sa intestine? No? Sa small intestine naman, no, yung mga villi na pinag-usapan natin kanina pala, Meron kasing mga autoimmune diseases wherein merong allergy yung patient sa gluten. No? Diba, nakita sa groceries ngayon, marami ng gluten-free food, no? So, nagkakaroon sila ng allergic reaction, no? Immune reaction doon sa gluten na pag nakain nila. So, they will undergo diarrhea. So, dahil yung villi madi-destroy, wala na mag-absorb ng nutrients. So, nagkakaroon ng malnutrition. Ano ang sakit yun? Na may allergy sa gluten. Meron din yun, nasabi din natin yung sa anatomy. Anyone? Plus 10. Ayan, galing ni Bulikit. Oh. Sige.
Celiac disease po.
Yan, don't forget your celiac disease. So, pag nakita nyo yung may word na gluten, no? Tapos may villi o celiac disease. Okay? So, yun po. Ito, tingnan natin yung transition din between the rectum and the anus. So, this is the recto-anal junction naman. So, tingnan mo yung rectum natin, no? Sabi natin kanina, it is lined by simple columnar epithelium. Pagpunta niya na, mag-change na sa rectum. Dito sa junction, nagiging stratified. Tingnan mo, flat-like structure, stratified, squamous epithelium, no? Non-keratinized. Laminophobia. So, ganyan kaganda yung slide. Okay, pag nakita niyo to, colon to, simple columnar, tapos biglang naging stratified squamous. No? So, that is your recto-anal junction. Okay, meron ba tayong tanong? Clarification. So, sabi niya, it wasn't a fart. My lower intestine blew your kiss. Pag nautot ka, nasabi mo, hindi po ako mutot, no? Naubo lang. Babang ubo. So, may question? Hostess? Hindi pwede. So, next meeting na yan. Thank you for your attention and participating. And participation. May tanong pa ba kayo? May naintindihan naman ba kayo?